now.
Oh, that's a new. I got a thing that says agree. Okay. Welcome to the Tuesday, June 8th, 9 a.m. Southborough Board of Health meeting. Maybe this is one of our last virtual meetings. We'll see. But I have a statement to read from the governor. Pursuant to Governor Baker's March 12th order suspending certain provisions of the open meeting law, and the governor's March 15th order imposing strict limitations on the number of people that can gather in one place, this meeting of the Southborough Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation by members of the public and or parties with the right or requirement to attend this meeting can be found on the Town of Southborough website. For this meeting, members of the public who wish to watch or participate in the meeting may do so in the following manner: by finding the meeting at Southborough Virtual Meetings, southborough.com virtual meetings. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technological means. In the event that we are unable to do so, despite best efforts, we will post on Southborough's website an audio and or video transcript or other comprehensive record of the proceedings as soon as possible after the meeting. Phew. Be nice not to read that again. Welcome everybody. Did you get agenda? Everybody have the agenda?
Yes.
Okay, super. The first thing I want to move to approve the minutes of, we have 2 meetings which we need to approve because we had, that last meeting was kind of quick, so we didn't do meeting approval. So the first meeting, I'd like to make a motion to accept the meeting minutes as posted for, or as sent out for May 5th.
I second the motion and vote to approve those minutes.
Thanks. Chelsea?
I'm going to abstain. I wasn't at that one.
Okay. And so, and this is Mary Lou and I vote yes to approve the minutes as written. And the May 12th meeting, I'd like to make a motion to approve the minutes for the May 12th meeting as sent out.
I second the motion and approve the meeting minutes.
So I have one thing that I'd like to add. We should be putting our motion to adjourn in the meeting minutes and then including the roll call vote.
Okay.
So, and I don't think the tape is on YouTube yet, so I didn't go back and watch it, but I'm pretty sure I made the motion. Mary Lou seconded, and Nancy, I think you had already signed off, but if we could ask Barbara to just double check that, then I'm okay with the minutes with that one change.
Okay. Sounds good. Got that, Barbara? Yeah, okay. The next thing on our agenda is our
Sorry, so did you want to do a roll call vote on that?
Vote to accept the minutes with Chelsea's edits. Nancy, how do you vote?
Yeah, this is Nancy Sacco and I vote aye. Yes.
Chelsea?
Aye.
And Mary Lou, aye. The next thing on our agenda is the FY21 year-end fiscals, and I don't know if everybody has those. I know there was a question, Chelsea, you wanted to add this, and I was at the office yesterday, and we couldn't quite figure out the difference of the two financials that we were looking at. So maybe you can help us figure that out.
So I had asked Carla to run year-to-date financials for Board of Health. And then I had asked that to be sent out to the entire board. Did you get that, Mary Lou?
I did. I have that.
Okay. So Nancy, do you have that?
Yes.
Okay, perfect. I just didn't see it go out, but maybe I missed it. So, and I did touch base with Carla on this, and this is what's been spent year to date compared to the budget. April and May salaries that are applicable for FEMA and or CARES. Those journal entries have not been made yet. So Carla has the detail as presented, I believe, by Heather and Barbara to make those journal entries. So those are the only two line items that will change with the FEMA and CARE. So that would be for salaries part-time and salaries full-time. So whatever time is applicable for people being at the vaccine clinic, et cetera. So I just wanted to understand, and I believe Heather is the approver of expenses for this board. So I just want, outside of the regular day-to-day salaries, I didn't know if there was anything big coming at the end of the year that we should be aware of, if we think we're in good shape for year end. So I was just looking for an update on that. I don't know if that answers your question, Mary Lou, or not.
Well, just that I know what you print and what you sent out, but what I had reviewed with Barbara and Heather was different. There were different numbers, so.
So I didn't get
Salary.
anything else from Barbara and Heather, so I'm not sure what you're.
Okay.
I did talk to Carla, and she did state too that I have been the only full-time person for a few years. But now my line has changed because Taylor's full-time. So some of that money is Taylor. So that's why the numbers are kind of convoluted. Because now she's a full-time employee, so it has to be pulled out of full-time budget.
So under the full-time line item,
Mhm.
it's the both of you, and that was what was kind of messing things up. Okay. Okay. All right. So other than that, Heather, I don't know if you have any thoughts. I know we talked, are we in good shape line items? Are there any lines we should move?
So that's what I didn't understand. The salary line items were higher than the one that we looked at with Barbara, but you think that that's covered through CARES Act? So are the salary items don't need to pull from the other line items?
Right.
Okay, so then on the other line items, there was still a contractor line, which we think will come pretty close to zero with the June contracting work.
Mhm.
And then there was a little bit on two other line items. We still have a couple small things, office orders, but I think we'll be fairly close. I don't think on the lower line items we'll go over on the supplies.
I think we may have more than we need in the in-state travel. So
Right, so
I think
that
if
we
can
would
move
move.
that if there's some other line item that's going to be a little short, maybe we'll.
I heard that because this is what Carla told me yesterday, because it has been a COVID year, more things have been done virtually, that they want the in-state travel to go back to them. Chelsea, am I right?
That's right. Yeah.
Okay.
So we did not get rid of any travel line items last year because then we didn't want to have to redo it for FY22. So we're expecting that departments will be returning money for in-state travel
Okay.
or out-of-state travel for that matter,
And
assuming that it will be used next year.
right, but unless there's something that's necessary that's not covered, is that?
So
not-
that's what I'm asking. I'm not hearing that we're going to have anything come up that's going to cause a line item to go over that is necessary to be spent this year. Is there?
Heather? Any?
I know Barbara has a couple office supply orders, et cetera, but there is a teeny bit of in-state travel, you thought, Barbara, still coming up, but
So
I
then-
don't think there's going to be something that goes over.
It looks like there will be some money there that will go back.
We
For
shouldn't
in-state
go over.
travel,
For
right?
in-state.
I think the others will mostly be spent, but the in-state travel, yeah.
Okay, all right.
And what about the training?
We may move that to office. I think there was a little bit more office stuff, supplies, Barbara.
I'm still
little
waiting
bit.
for invoices from
Right.
Quick Print
Right,
or a business
so a little
card
bit, but there
envelope,
might,
but that won't
And-
eat up the whole thing though, no.
Okay. You mean it won't eat up the whole office supply line or Or,
It would go under, like the print and email communications, we can use some of that, and I know business cards are more, so it would go into another line a little bit
okay,
to cover the costs. But,
okay,
but it's nothing like we're ordering a $5,000 machine.
Right. We were also going a little bit in, we potentially might go into a little bit, the wireless, we were also getting those hotspots from, the state's gonna cover most of it, but Taylor might know about the contract with that, and if there's any service that might go into a different line item, because that will,
I don't think there will be. If there will, it'll be like a negligible amount, like under
right,
$50.
small amounts.
Right, and we still have money in the wireless communications too, so.
Right, but
that's
that will
out of
be
there.
spent, is our understanding.
the what, so for phones, because
Right.
we still have it in this year's
Yep.
budget, but we're moving it out. We don't have that in next year's budget, right?
Right,
Correct. It is,
Okay.
for this year, that is ours to spend. I double checked with John Parent. And I believe we still have, a few more bills to go through for that. So that will be spent down at least somewhat.
Okay,
So they didn't pull wireless out of our 21 budget, but took it out of the 22.
Correct.
Okay.
Correct. I
Yeah.
confirm that. Mhm.
okay,
Okay.
okay, thank you.
Okay, next is I want to make a motion to vote to hire Dr. Louis Faison for a consultant contract that would be for 5496. It's a project using grant money that we already have in town and needs to be spent by the end of June 30th. And Heather and I have talked to Dr. Faison, but I can give a little more about that, or Heather can talk a little more about that, what that would entail. And it covers the criteria for that grant money.
Right.
So Heather, you want to explain what that?
Via sort of MHOA as a vehicle, the state public health with the COVID crisis was providing money to towns for local public health in relationship to COVID. And basically, since Taylor and I have been here, 90% of what we've been doing is COVID. And we're in kind of a tight spot going forward, and we've uncovered a lot of things, things we've spoken about before, the data that comes in, the information that comes in on COVID patients, and not really having a plan for that. So this will be a consultant for June who's going to look at where we are, what we've what are priority items that we've sort of missed and not taken care of during this emergency, and then also looking at our function with continued communication and public messaging to the public about what we do in terms of we've made it successfully with the vaccine clinic, but really haven't had the appropriate communication with the public and employees. So look at functioning and communication with public health and the healthcare systems, the channels that we have in terms of scheduling folks for COVID tests, getting COVID test results, some of those channels to look at communication as well. But not specifically working on the website per se, that we're going to look to for a different consultant, but just sort of look at our communication channels in terms of public health and healthcare.
Awesome.
Can I ask a few questions?
Second to the
Oh,
motion?
second.
Oh, great. Yep, Chelsea?
Thank you for that. Can I just ask a few questions? So is there a scope of work?
We're developing that. Yep.
So are we gonna get to review that?
Yeah, sure. So Heather, do you want to read the scope as we have it right now? It's pretty, it's pretty short and concise.
Let me
'cause the
look.
time frame is so short. So I think, I mean, it's like a few bullets. I don't know, Heather, you can read it. And where it's left now, Chelsea, is we sent it up to Mark and Carla. that, and Mark had said he would create it into a contract because we're so time sensitive if we voted to move forward today.
Okay, so this is what I have so far. The scope, transforming pandemic urgency to continued public health policy, redefining our local public health in the emerging post-COVID era to address unmet needs and promote community health. Scope of work, access existing health data in Southborough, encompassing school health and elder health and mental health. Using SWOT analysis, evaluating our strengths, weaknesses, and threats to incorporate perspective of staff and community leaders. Building on public health expertise to envision methods to address social determinants of health in the community while maintaining Board of Health function. Plan is to deliverable is to communicate to the Board of Health and town leaders with a written report describing functions going forward to coordinate a cost-effective approach to maximize health outcomes.
And the work would be, I think it's also, the work would be completed by June 30th with the report to follow in July.
So is he going to take our COVID patient data and analyze it and then give us a recommendation on how we should be communicating to residents going forward?
Right, I mean, communication channels with healthcare providers, as well as communication with town employees, as well as residents, in terms of communication in all those areas are definitely lacking in the COVID. So to use, to kind of look where we are and look at strategies to strengthen those data and communication lines, as well as what in the past sort of year, what regulations are we not meeting due to the emergency? And
I
sort of
would-
prioritize that going forward, because we now need to step and meet to other functions that we have not been doing.
Okay. And do we know the number of hours that he's dedicating to this? I mean, $5,400 in 2 weeks seems high to me.
Right. I had talked to him. Well, he's going to spend some hours in July. I think he finished the report. The report doesn't need to deliver by June 30th, but
Okay.
the money for the project will be paid. He's we were talking, it's going to take roughly 30 to 40 hours was what our kind of.
I know he had planned to interview Board of Health people, maybe other town people, people in town that will be somewhat time intensive, I think. And then, I mean, I'd hope that it would be more of a focus of how did COVID impact our ability to do our day-to-day work. And then COVID isn't going away. I mean, even though it's post-emergent COVID, it's still there. And so how do we deal with the ongoing responsibilities that COVID presents and get the health department back up to where it needs to be for meeting our requirements?
And does he, has he performed this for other towns? Do you know?
He, Dr. Faison, I don't know if you remember, he was the chair of our Board of Health for many years.
I know the name. I don't know that I was around.
Yeah, he's a pediatrician and he was on our board for many years. He's now on the board of Sturbridge. He's on the Mass Medical Society. He's the head of the Public Health Commission. He's got a strong public health background. I mean, I feel lucky that he has the time to even do this for us right now.
Okay. Okay.
Nancy, do you have any questions?
No, I know him well from, working alongside with him, and I think this would be great. I think he'd be wonderful at this. And it would be of great benefit to the town.
Yeah, and I'm thinking that it's really gonna have, an analysis and then some recommendations, and it's gonna be up to
Mhm.
us what we do with those recommendations.
Right.
But at least it'll give us an objective view of what's going on, and
I agree.
Okay.
I agree.
so do we want to take a vote?
I'm sure this is Nancy Sacco, and I vote aye in hiring Louis Faison in the capacity as mentioned.
Chelsea?
I'm supportive of it. I just would like to see the scope, the final scope and contract prior to it getting executed.
Sure.
And I just wanted, have we validated that the grant covers this scope? And because I think we have the money, right? And it's up to us to, okay, okay,
We have the money, and Heather has spoken with Don Cyber, who is overseeing the grantor.
If it meets,
That met the criteria.
met certain categories. And so I think the grant will touch on a couple of the different categories. If the work is within that scope, and I did talk to her about hiring a consultant. Yeah.
okay.
But this is kind of time sensitive, right? So
Very,
Correct.
like we kind of need to
yeah,
decide today, right? Would you say, or,
yeah. And this is Mary Lou, and I vote yes.
okay.
So, I think Mark had said he would work on that contract if it was voted today. So, Chelsea, when I email Mark, I'll have him reach out to you to get.
Okay, that'd be great. Thank you.
Next on our agenda is, we need to reelect officers for this year.
Before we do that, I just want to say, I will not be rerunning the next term. And I'd also like to apologize for this past year. Been a little overwhelmed with my own stuff at work and my family, so I don't feel like I contributed as nearly as much as I should have. So that being said, I kind of would prefer to just stay on as clerk. I'm just putting that out there.
And when is your term up, Nancy? Is it next?
I think you're up again in May, and then I'm up the following year. I honestly was not going to rerun, but it was the middle of the pandemic a year ago. And obviously I didn't feel right leaving the town at that point. I've been on this board a long time and I've really enjoyed it, but I do just feel like my heart and my interest isn't where it should be. So that being said, if anybody finds somebody more motivated, before I'm up for reelection, please let me know. I'd be more than willing to step down. I'm happy to stay on, but I'd prefer to just be as clerk, and because I don't feel I'm in the position to be the chairperson at this point right now.
Okay. Chelsea, do you have any thoughts?
I am happy to do whatever you want me to do. I mean, I'm open to do, chair, vice chair. It doesn't matter to me, Mary Lou. I obviously appreciate both of your efforts throughout this year. And Nancy, I think you're underselling yourself a little bit. It was a tough year for everyone involved in town government. So,
Well, I feel like a lot got put on Mary Lou, and and I feel terrible about that, but we all do what we can do. And I think I just got home from work and I didn't have another thing to give to COVID. Quite frankly, I was tired of it, and that's not right for the town or Mary Lou. And I do apologize for that.
No
so
necessary.
I'm happy to do either, Mary Lou. It doesn't matter.
So I was thinking, I think, as you all know, we're selling our house. I'm not sure. I mean, I could end up staying in Southborough. So I was going to say I'm willing to continue as chair until that next time comes. And then
I would love that.
discussion going forward. I'm kind of knee deep in everything right now, so it probably makes sense. Does that work, Chelsea?
Yes.
Yeah.
So can I make a motion to have Mary Lou stay as the chairman? And myself as clerk, and Chelsea as vice chair?
Second,
And this is Mary Lou Woodford, and I vote yes.
Chelsea, I.
Nancy, I.
Okay, that's done. Next on our agenda is a quarantine violation appeal. So as some of you know, or all of you know, we have had strict quarantine and isolation requirements based on COVID status. And we had to issue a fine for some non-compliance. And so that those people want to appeal. So I didn't know, is the person that's appealing on? Okay. And maybe we can bring them forward, and Heather, you can explain the situation for the board. And then our person appealing can speak to what happened, and then I'm hoping we can just take it under advisement and let them know what our response is.
Needs to unmute.
But Heather, can you explain the situation?
Okay, so this is a violation of the quarantine as outlined in Governor Baker's COVID emergency. And this is a family, just for a timeline, who has a student at the Faith School in Southborough. And the student was at school April 20th. And that is where the close contact occurred, at the Faith School. And the April 20th was pool testing for that grade and was positive. There was actually 4 students that were positive that day, I believe. So April 20th is considered day 0, the day of exposure. On April 21st, the next day, the pool testing was run individually, and the positive COVID cases were identified, as well as the school identifying the 6-foot contacts for quarantine of the positive students. The school has a quarantine policy for contacts of a 14-day quarantine. So the family was notified that week once the positive test was returned the next day, and then the contact's name. The family was notified by the school for a 14-day home quarantine. The family just does not live in Southborough, but their student is a day student at Faith School. Over the weekend, on day, I think 4 or 5 of quarantine, the family notified the school that they were scheduled to take a trip the next week on April 27th, and asked local board of health with jurisdiction over the school, which is us in Southborough, to call the family to review quarantine. That day, it was April 25th, a Sunday, I called the family. I spoke with, I believe it was the mother, and we had a conversation about the definition of the 14-day quarantine as recommended by the school. As the local board of health, we did not feel it was appropriate to override recommendations for quarantine. This school at this time, like I said, had 4 students who were positive. So This was really important with, more than one case at the school to try to limit the spread and potential risk with the students who were named as close contacts. So on day 5, that was a discussion with the family that the local Board of Health was holding up the quarantine at Fay School. The next day on Monday, April 26th, I notified the local Board of Health in the town where the family lives. They as well noted this in the Maven case, the plan for the 14-day quarantine, and they were in agreement with the plan per the Fay School. On April 27th, despite orders of quarantine, the student flew to Texas. The school received notification that the student was in Texas. We were notified on April 28th, I believe, that the student violated the quarantine order. I discussed this with the state epidemiologist. The state epidemiologist confirmed that the quarantine order was violated, and the state epidemiologist confirmed that enforcement of quarantine orders are done locally, not by the state. Then again, we discussed with the town of residents as well. They considered violation as well, but agreed that we would issue a violation to the family. And that was with guidance from the MAHB violation notification for the quarantine. And that was, our town is aware. And I believe that was sent April 30th to the family, and a certified receipt was returned. The family received the violation notice. It was early May, May 4th. The family received notification of violation of quarantine, and the family has appealed the violation.
Thank you for that summary, Heather. And is it John that we have? Can't hear you, Barbara.
I muted too. If he could unmute, I just asked him to unmute.
Okay.
Okay, I'm unmuted.
Hi.
Hi,
Is it John? Thank you for meeting with us. And
yes,
I think, were you able to hear the summary of our public health director?
I did, yes.
And I just wanted to offer you to respond and what your thoughts were.
Okay, just my reason for appeal was that everything, it was mandated locally. Whereas, I mean, the whole conversation is the state and Governor Baker and the state and the state. But in this case, even you went to the state. In this case, it didn't apply to close contact rules in the classroom, which would have resolved the whole problem. DESE that day had put out that a 3 foot, 3 feet of distance in the classroom with masked students are not considered close contacts. I thought that the desks would have been 6 feet apart, being in a classroom with 7 kids. But unfortunately they were less. I had them measure. She said they were less than 6 feet. The Fay School did, but they're not within 3 feet. That rule was put out the day that he was in class by the Department of Secondary Education or whatever, grades K through 12, by the state. So, by the state, he's not considered a close contact. As a safety precaution, we had him on the 5th or 6th day brought to Cambridge before we had flown to get a PCR, and that showed up negative. Which, even more confirmed thing. I know there was a kid in the classroom, maybe 2 kids that sat close to him that were close contacts, but being fully masked in the classroom, one class for 45 minutes without even facing the kid, I just don't see it as a close contact by the state. And that's why we were appealing. Had it been, the only thing that would that's the only thing basically that's kind of getting us out of this. If it was within 6 feet and stayed within 6 feet, then we wouldn't have been able to fly to Texas. We have since not returned him to school because of this. And that's why I'm calling to appeal.
Heather, Taylor, do you have any thoughts before we take this under advisement?
About the DESI guidelines, you mean?
Or anything that John has talked about. I know it's a school, and the school has the ability to have its rules. The 14-day quarantine was very strict with Fay School, even though the state had allowed schools to go less days. Schools had the ability to continue with the quarantine of 14 days because of the safety of students. So I don't know when Fay School implemented the 3-foot.
Fay School does
they
not
never
have a
did.
3-foot.
So
They
Fay
did
School
not,
is
no.
continuing the 6-foot rule.
Correct. If they're within 6 feet, they're
But
a
the
close
state,
contact.
but the state had gone to a 3-foot rule.
Right. I hear you, John, in that.
No,
No,
not
what?
on April 20th, the day of school.
When did,
Not
when
on
did
the
it
day of
start?
contact. The day
When
of
did it-
contact was during school hours on April 20th. So the DESI guideline was not in place. And that's
When
a
was-
public
when-
school anyway, but it wasn't in
When was
place
that
on
in-
April 20th.
When was it in place?
It was not in place on April 20th.
Okay.
Yeah, so my understanding is that's a public school guidance that April 20th, Fay School was in session, but public schools were not. And so that guideline was kind of proposed that week and worked out that week. So it wasn't in effect till the next week when for the public school students, when they came back, but it was not in place on the school day of April 20th. That I know. It was started to be discussed that evening, but it's not retroactive. So that was not in place until the next week when public school came back. And I think that's why they did it that week, that they kind of proposed it and worked it out with the state. They had those 3 or 4 days because the public school was not meeting. But Fay School doesn't have to follow DESI guidelines, but that was not in place on April 20th, the Tuesday where the student was in school with the positive case.
I mean, that's when we found it on the website, on the state website, the DESI website,
You found that on April 20th?
that we found it that day. Yes. Because we were worried about quarantine. They told us that everyone had to quarantine, like siblings as well, because he was in our house. I mean, he had just gotten off quarantine. This is the one day he went to school in the past like 3 or 4 weeks. One day, or. you know,
Right, the
what-
contact was April 20th. Yeah, no, it was not in place. It was first discussed that evening by the state. But first of all, the DESI is not applicable to Fay School.
No, I know that, but
and-
it's
and
applicable
even-
to the state, right?
Just so you know, with the state, with the DESI guidelines, someone at 3 foot is still considered a contact. They're still tracked by the state as a contact.
Yeah. Fully masked
But-
in the classroom,
Right, they're still
because
tracked as
everyone's
a
masked.
contact.
FA, everyone's masked.
Right, exactly. But it wasn't in place on the day, on the April 20th, first of all.
But it's also important to note that private schools do not have to
I-
follow the DESI guidelines that are specifically for the education, public education in the state. So it's a board. There's a separate board that gives governance and guidance for private schools, which is completely different. So Fay School has the ability, just like every private school. I mean, as you probably know, some private schools have been in full in person for a lot longer than, you know, when public school was remote, because they have the ability to set rules based on their private school status. And so as a Board of Health, we work in partnership with our schools in town, St. Mark's and Fay School. And so that's the reason for the violation. And honestly, it's, I mean, if he could have infected a whole plane, you know, flying to Texas.
After a negative test, after 5-6 days, whatever the guidelines are for that.
But the quarantine period wasn't followed. Even the shortened quarantine period wasn't followed. The quarantine period, and the quarantine period is done to reduce risk. And with the shortened quarantine, there's still a viable risk. There's still a risk of carrying disease. But the violation was on day 7. The student's still in quarantine, even if they have a negative test.
Because he needs to be 14 days.
Yes, at that point, Fay School required 14 days. And part of that reason, John, is that if you get a negative test before day 8, you are not released from quarantine because you could still carry the virus and spread it, even with a negative test. And that's the whole reason for the 14-day quarantine. There are many times we have had cases where they became symptomatic in day 10, day 11, day 12. And so you're contagious for COVID 48 hours prior to symptom onset. So on day 8, you have no symptoms, you think you're great, you go to a public place, and then you develop symptoms a day later. You just infected all the people you were around when you had no symptoms. So that's the
I understand that.
Right, and just so you understand this, I mean, the Fay School quarantine is upheld by the local Board of Health, but also there's state quarantine. There's a quote 7-day, 10-day, and 14-day option. That this is in violation of local and state quarantine. The state quarantine options, there is an option for a 7-day quarantine. I think you were talking about that. The state quarantine with a negative test on day 5 or later does not allow a person to leave quarantine till day 8. So the state quarantine was broken as well. The state quarantine for leaving day 8 includes monitoring of symptoms up until 14 days and does have a residual risk that the exposed individual is carrying COVID. After 14 days, that risk goes down to 0. But there is 10-day and the 7-day, there is state quarantine options, but this was a violation of the state quarantine as well.
With regards to him being a close contact in, well, I don't
Well,
understand.
regards of him leaving quarantine.
After 7 days?
No, he didn't leave after 7 days. He
He
left,
left on
he left before the 7 days are
On
completed.
the 8th day, right? He left?
He left on the 7th day.
He left on the 7th day. Okay,
It's in violation.
okay. I'll have to look at that. I don't, I thought it was, I thought he left on the 8th day. But if you're saying 7th day, that's fine. I thought he was in contact on, was it a Monday?
The 20th, it was a Tuesday.
A Tuesday?
Yeah, so that's day 0, and then you count forward. Yep,
And then they flew out on,
Tuesday.
no, it wasn't a Tuesday. It was a Wednesday, I thought.
No, it was Tuesday. We have the emails.
You do? Okay. I thought it was Wednesday for some reason.
Wednesday they were playing, Tuesday they were flying.
Oh, they didn't play Wednesday, they played Thursday. Okay. I'll have to look at this further and then get back.
Thank you for coming, John, and not sure what there's anything else to say. Does any other board member have any questions or comments?
No, I mean, I do appreciate that you went and had your child get a PCR and all that. And I do agree. It's a lot.
No, it is
And
it is a lot for him. He gets a transfusion every 5 weeks.
yeah,
We pay for his ulcerative colitis. He's missed so much school. We pay so much money to go to the school, and it's like the one day that he goes to school, he has to give up the one thing he's been working for, all year, which was
Right.
a national tournament in Texas. So yeah, it is a lot for him.
it is a
To
lot.
go
And I
to go every
appreciate,
5 weeks. He's tested. Not
Yeah.
only is he tested every week, he's tested with the medication he's on. It's in the research has shown that the steroid infusions that he gets every 5 weeks, the kids aren't getting sick, and he hasn't been sick. He could probably be in close contact with 100 people, but I understand that. It's just that, whatever, it's fine. All right.
We'll take this under advisement and send you a response from the board.
Okay. I
you,
appreciate it.
John.
Thank you.
all right, and good luck with everything. We're seeing the light, hopefully.
Right.
Uh,
Thanks.
That's a tough situation. I don't envy.
Yeah. Heather, you were going to give an update, ironically, just after that, our COVID update
COVID.
and vaccine.
Right.
clinic.
Our vaccination is up and vaccination works. We haven't had a case, knock on wood, in the town in a week or two.
Yeah.
And
The last
that's
case came out of quarantine on 5/25.
Nice, good.
So we have no active cases, and our vaccination rates in the town of Southborough are very high. Those are tracked every Thursday, and they report data as of Tuesday. So last Thursday, we looked at data in our town and for the 7 towns in the regional clinic. And in a lot of metrics, especially in our youth, we're leading the way in the state. And we calculated for those 16 and above who have been eligible long enough to be fully vaccinated, the rate is 82% of our Southborough residents are fully vaccinated, which
Right.
is excellent. And our 12-year-olds, we're seeing a great response. They've only been eligible for a few weeks, so we are just starting second dosage, but they're not quote fully vaccinated because they need 2 weeks post the second dose for that. But 79% have gotten at least one shot as of last Tuesday. So this
Nice.
Thursday, we'll get numbers again, so that number will be in the 80s as well this week. So the youth are definitely showing up from our town and getting vaccinated. So that's excellent. And I think I've mentioned that we have done outreach with our
Mhm.
75 plus group and getting a couple, responses that way. Anything else? I think we haven't, our clinics next week are going to start slowing down because that sort of demand is not there. So we will look, I think our lowest group might be the 60-year-olds, but we think potentially some of them are vaccinated out of state. So we will think about that. I don't know if there's too much we can do about that, but we're gonna think about looking at that. But our youths are like 30, 20-year-olds, 16-year-olds, they're greater than 95% vaccinated.
Oh, so like my daughter got her
Out
vaccines
of
when she
state.
was out of state in Missouri. So that won't show up on your
See,
data.
that's why our data, I think, would be higher if the out-of-staters. We're
And
gonna
I
ask-
know a lot of other of her, my friends whose kids were in other states for college.
Right, we're
got
gonna ask the state
vaccinated.
about that. I don't know if there's much we can do about that, but we're gonna
I
We're
think
gonna
it
ask.
also depends on what, even if they got it out of state, if they list Southborough as their address when they get the vaccine, then it would be
Right.
included in our data.
Oh, okay, then it should be because this is her. Okay. Very good.
So I think people with second homes, things like that, they list their address as the out of state address. They're not showing up in our data,
I
but
see.
they also have
Okay.
an address here. So it's kind of skewing the data a little bit.
Okay. I gotcha.
Well, that's all really good news.
That is.
And now, reopening, have you been involved with town offices, Heather, in the reopening plan, and what's the plan for our Board of Health office?
Right, so June 1st, we had reopening of our public buildings. And, we were involved with getting ready for that. And I think it's gone well. I haven't heard anything to the contrary. And then the governor's state of emergency is being lifted on June 15th. The June 1st reopening, if we want to discuss a little bit about our plans here at Board of Health, our building is no longer locked. And the plan we had talked about in the office was going forward with the reopening to the prior hours that we were open that are posted. It's basically 5 days a week in the morning and then being available in the afternoon by appointment. So those are the hours listed. I believe it's 8 to 12:30 most days. So if we wanted to discuss that, what folks thought.
I'm excited to see things reopening. I hope people aren't, feeling so cooped up that they're going to go crazy. But which, we are seeing some of that, especially among the younger people. But thankfully it's summer, people are outside. Hopefully that'll be helpful.
Yeah, great news. So we'll keep the Board of Health office regular hours in the mornings, but then should we have like a by appointment in the afternoon? Like any thoughts on that? Or do we think just the regular hours in the morning will work? Heather, Barbara, I don't know.
It's what people are used to. I think if we do like an appointment in the afternoon, then we can accommodate them.
Okay.
But they're used to the morning and they're pretty good about sticking by it.
Okay.
Good.
Okay, so maybe
Mhm.
we can just take note, like, if like over the next month, let's, either people that can't make it during the morning or whatever, and then you can just let us know. Or maybe if we had something on the door that said, if you are unable to come during these hours to call or something like that, then you would know, right?
Cause you lock the doors at 12:30?
No.
No, okay. So do you get stragglers? Not
Um,
stragglers, but you know what I mean. People, that's
No,
not
I
the
meant
right
the
word.
building is now not locked. The whole building
Okay,
had been locked. Yeah.
okay.
Okay.
We could maybe put something on the website too.
Yeah, that's another discussion. But yeah, that would be great. We need to figure out the communication piece. Okay, so that's great news. We're open and people can come in the morning, so that's great. Shared services grant. Heather, do you want to give an update on where?
So we did meet yesterday. We are in the planning phases and getting, yesterday we worked on the nursing scope, just to refresh. The shared services grant was applied for state money that had been allocated back a couple years ago in 2019 for advancing local public health excellence. And the grant we submitted was with 4 towns, 3 boroughs and Boylston. And we submitted to the state $300,000 per year, which was the maximum. And the money is, as per the state, wanted really to focus on manpower and people to advance local public health excellence. And so our grant is going to be used mainly for nursing hours. That's sort of the biggest ticket item on the grant, and some inspectional services for food and housing. So not help with our septic per se, we're mainly septic town, but help with the other inspections. And yesterday we looked at the nursing scope of practice, and the town needs to sign off with the intermunicipal agreement, the IMA, and the draft Chelsea brought to select board, and there were comments. And then I think because my understanding, that process takes a little longer. So there's also sort of a quick form for the town to sign by end of June, which is just an agreement. It's a shorter form just to sign off. And I think the IMA is not going to be done by June, is my understanding. So we did have questions on the IMA that we reviewed yesterday in the meeting from Southborough. The other towns did not have any questions, but the meetings have 4, there's a representative from each of the 4 towns. The quorum is reached when 3 members are at the meeting. The voting will follow for decisions on a Roberts rule. So a 2-2 tie, there will not be a tiebreaker, but there will be reconciliation until a vote is cast to break the tie between the 4 towns. And there had been a couple other questions, but we did discuss them yesterday.
The other question was legal counsel. And
Ah,
so, all of the towns, well, the agreement was reviewed by
Cheryl Sabara.
Cheryl Sabara, who's a lawyer for the Mass Association of Health Boards, to try to help eliminate any legal costs for towns. Now, any town that wants to run it by legal counsel, they said absolutely, it's whatever you decide to do, but just so that it's already had legal review by an independent public health lawyer. So
Okay.
I don't know where it stands, but Chelsea, sorry for the confusion yesterday. It was really just, I was on because of the scope, but from this point forward, I know you're going to be the alternate for attending those meetings, and maybe you can work with Heather to get those agreements signed with the select board.
Yes.
Great.
So,
Right. there's a letter of commitment, the shorter one that I
Yeah.
found in my email last night, but I had asked Connor to clarify that with me at the meeting, but he didn't get back to me, but I can try
So
again,
if
but
you
that's my
can-
understanding.
If you can let me know by tomorrow morning, Heather, then I can include it in our packet for Board of Selectmen next Tuesday.
Okay.
And then what I'll do is I'll add a discussion on the IMA to see if Southborough wants to continue to use town council to review it, and I'll explain what's already been reviewed. But if I heard you right, then the short form just needs to be signed by 6:30. And
Letter
then-
of commitment, right, and I
Okay.
don't believe that, I don't seem to have a date, it's a moving target, but I don't believe the IMA is by 6:30, but the letter of commitment is, but
Okay,
it hasn't been strongly clarified, and
okay,
he didn't get back to me yesterday, but I will try today
Okay.
to get that clarified, but that's my understanding, is that one's a shorter form, and I believe that's signed, the letter of commitment, maybe by Chair Board of Health, and then by, maybe it's town official, town admin,
It was town
town
admin
admin
and
and Board of Health,
Board of Health. That one doesn't
right,
select board,
well, it's not
uh,
a select board.
but they
Okay.
should be informed of what's happening.
Right,
Okay.
it's
It's
sort of,
really just, we're signing on to do this, and then they will need to sign the IMA when that
Yeah.
happens.
so.
right, it's a commitment letter of kind of commitment.
So we're meeting on, selectmen are meeting on 7/13. So,
6/13, June,
7/13, so 7/13. Because
July.
because the legal won't have weighed in by 6:15.
Oh,
So-
okay, got it, July
So
13.
I'll bring this up as a decision point next Tuesday on 6:15 to see if we want council to weigh in. Then we have until 7/13 to sign off on it.
Okay.
Mhm.
Okay, so if you
All
can
right.
just confirm.
I'll
if
confirm that with Connor.
7/31
Okay.
date is different.
Is the IMA date
Yeah.
would be okay for a 7/13, yeah, okay.
Okay, thank you.
Sounds good.
And then there was an invoice question. I think
Ah,
it's section
so
7.
this is to supply, this shared services is to supply money to the town to use for staffing and for a few materials. Well, for one, the software, and the, iPads. The invoice was kind of used as a sort of generic, boilerplate, but it does apply to all towns if there's invoices for material, but the point of the grant is supply materials, so no invoices are expected because this is to supply things to the town, but it was just sort of a boilerplate. If there are invoices, pay it in a timely fashion. It would apply to all towns, but they're not expected actually for any town.
Okay.
To have materials / invoices.
Thank you.
We good on that?
Mhm.
Okay, great. Noise bylaw results.
So I had asked this to be added to the agenda so that, one, we were aware of it, and two, kind of next steps for this board. So as you all know, at town meeting, there was a citizens petition for a noise bylaw, and the feedback was that the residents would like a noise bylaw and it needs to kind of be reworked. And so at the selectmen meeting last Tuesday, we took a position to draft a charge for the noise bylaw, and to have a committee formed to come up with a warrant article for town meeting. And I thought, given this board's involvement with noise and current issues that are going on now, that you should be aware of it and see what kind of participation this board would like to partake in. There'll be a process with appointing people to this committee to work on it. But I didn't know if this board wanted to encourage a Board of Health member to be on that, either as a voting member, as a resident, or an ex officio if we wanted an employee to do it.
I know, I think that it's important. I mean, noise falls under the purview of the Board of Health. And So I think it would be really important that the Board of Health has a voting right on this to develop. We've been dealing with noise issues for a long time on
Mhm.
on a lot of different scope of things. So I think it's important and to get the language right and to get the health impacts specifically understood for people. So I would like, Nancy, I don't know what your thoughts are.
No, I think that's a good, I think I would like that as well. Absolutely.
Does Heather, do you have any thoughts on
Yeah,
that?
no, I absolutely agree. Yeah, I would be interested in that.
Would you be willing to be on the committee to be, can we have does it need to be a board member, Chelsea, or can it be our staff?
So the charge hasn't been approved yet, so I'm a little bit ahead of the game. I really just wanted to kind of know where we all fell. So I can make a suggestion that the committee include an ex officio member from the Board of Health, which you would only be a voting member if you were a resident.
Okay,
If it's, so like the police chief will probably be part of this and he'll be an ex officio as well. So I just kind of wanted to know the direction that you were thinking you wanted to go with this, just to make sure that we had the input into the charge.
okay. Yeah, I
Okay.
think ex officio maybe makes sense for Heather to participate, but then somehow incorporate the Board of Health in the charge that we can review and comment and vote on the direction, if that makes sense. Like you said, it's still being developed, but I
So
think we definitely want to be involved
So
in.
do you want me to recommend that one of us sit on this committee? I mean, I think we could, I just don't know how we would have input unless we have a member on the
Yeah.
committee. And obviously everybody would need to, I don't see an issue with it, but I'm only one
Right.
person. So is that the type of input that you want to have? Or do you just want to kind of attend the meetings as one of us can and make public comment?
So the purpose that you understand now is to develop the warrant, the language for the warrant that's actually going to go to town meeting.
Mhm.
Yeah,
Okay.
like the bylaw. Yeah.
Right. Yeah. What
Mhm.
what would that look like? I also know, I think I don't know, I'm willing to be on it if you want. I mean, there's also the Mass Association of Health Boards has done a lot of work with this, have done Cheryl Sabara, who's a lawyer for that. She could give us sample language from many other towns. So I think it's a valuable, they're a valuable resource so that when you start looking at these bylaws or, you know, what it's going to look like to have input from other towns, I think would be helpful.
Yeah, I
Okay.
agree. I mean, the other thing is it doesn't have to specifically say in the charge that it has to be a Board of Health member. I think though, as a board, we could say, okay, Mary Lou, you're interested in doing this. You know, you could go through the process of, you know, applying for
Right.
it too. So I don't know that it needs to be specific. I guess I just wanted to understand kind of from your perspective, where you wanted to go with it.
Okay.
Okay.
It sounds like you got all you need for now, and then
Yeah.
we'll revisit it as things move along.
Yep, that's great. Thank you.
We have on here new grant opportunities. The only one that I knew of was the additional shared services grant, but we're technically not encouraged to apply for that because the old one is my understanding, Heather, correct me if I'm wrong. The other one was such a quick turnaround. A lot of towns didn't get
Correct.
a chance to apply, and so they reopened it to give other
For
towns.
5 more. They're going to approve 5 more grants, and those who did not apply the first time were encouraged to apply this time, is what they said in the state call. And then I did on the site, I sent a FAQ about applying a second time, and they sort of really questioned that as a sort of viable option. They said, look, this is about establishing relationships. We're not going to approve sort of a single service thing. And so we were sort of looking for septic, but they said they wouldn't approve that type of grants if you were already in one. It was a quick turnaround for the other one, so every application was approved basically. So they're trying to reach sort of the 100 towns that didn't, roughly 100 towns that didn't apply.
So what I had asked, Chelsea, when I saw the new money, I asked Heather to look into to see if we could join maybe another group to get septic shared services. And that's not going to be a viable option for us. So for now, all the Title V stuff really just falls on us at this point to do that.
Okay.
But we'll
And should
continue
we
to look for
discuss
other
the,
grants and stuff too.
I mean, and with the Title V, we wanted to eventually get that into a revolving fund, but that,
Yeah,
Oh.
actually, we did that before, Chelsea, just to put on your radar. We submitted to a warrant for a revolving fund for our inspectional services, but it was too late. So if there is a fall town meeting, I think we are assuming we stay in the queue for that to happen. But
Okay.
but we voted to move forward on that revolving fund. So that's still outstanding, but just because you weren't on the board yet, so.
Thank you.
The last thing we have is our communication consultant hiring. Heather, do you want to give an update on that?
well, this is timely. So there's CARES Act money in the town, and we had proposed some different consultants that Carla has a contact at the state in terms of approving use of CARES Act money. And she thought related to COVID, the CARES Act money would cover a communication consultant. We are up against some kind of really getting timely messages out on a public health, i.e. about COVID and about our vaccine, getting residents to know about the clinic, weekly updates. We're having really, there's limited website and updating of the website doesn't happen in a timely fashion. And in terms of COVID, this is still ongoing with COVID. We're expecting children to be eligible in maybe September. We want a consultant to look at our public health communications with the public in terms of getting messages out. This would be specific to COVID. It could apply to, future public health emergencies.
So one of the challenges, Chelsea, that, as Heather outlined, like just letting the public know, we can't, sending information to get updated on the website because we don't have the ability to do that. We have to send it through usually to Vanessa, and she doesn't have time to do it. So, and then by the time it does get up, and Jason, the new IT person, has tried, but he doesn't have the bandwidth. So we want a consultant to help us figure out what is the best way for us to communicate with the public, because our messaging probably 75% of the time is urgent messaging and time sensitive. And so by the time it gets out now, it's not always even relevant. And so,
Right.
So we've really, we get really frustrated, feeling like we want to report to the public information, how to get the vaccine when the clinic's open, and we just don't have any tools to do that.
And of note, I've been trying to get access to publish on the website since I started, and I still don't have it.
Oh, jeez.
Do you know the status of that, Taylor?
Jason spent a long time here last week trying to figure it out, and he couldn't figure it out. He said he's going to look into it. He hasn't gotten back to me yet.
So that would be great. So where is it now? I'm working on a draft for that language, and I'm going to send back to you, Heather.
Right, but we need to bid out the communication
Right.
consultant. I
Right,
think
but we got
that's,
to draft what that scope is. So I'll do that. I'll try to get that done today. Chelsea and Nancy, I'll send it out to you guys.
Okay.
For review, and that's basically just kind of like a mini RFP, like we're just gonna try to find the best person to do this.
Okay.
So do
But you-
do you want to schedule a time to approve that so you can get it out to bid?
Yeah, well, we're gonna need to have another board meeting because we have some contracts for review. Heather's contract needs to get signed before July 1st. Taylor's contract needs to be updated on a timeline. Paul and
Dennis, Paul.
Dennis's contracts need to be signed. So we need to get a Board of Health meeting on the books before the end of June anyway, so maybe we can do that at the same time.
Okay.
Okay.
I think that would, that would give us the time to tweak whatever it is that we need and a chance for everybody to review, and then we can vote on that then.
Okay.
And Mary Lou, you know where to bid this? I mean, you have contacts. in-
Yeah, I have some networks of organizations that just
Okay.
work on public health communications, so I could send
Got
it out to, as many people as I can. They're more organizations, but they might have a person that could help us with this. And then also speaking of communications, I know we've talked about briefly, how do we inform our residents about what we do? Because what has been painfully clear over the past year is how little like the public really knows what we're responsible for and what we do. And so one of the ways I thought would be helpful is if we report it out, sort of come up with a format. Because in the past, like when we do all these inspections and all this, if they don't come before the board, if they don't need board vote, no one knows what's happening. And
Right.
so I know Dennis gave me a list. Heather, you've reviewed the list. So maybe we can look at, yeah, that's great. And so all of the things that we do, and it would just be numbers. So like how many permits, how many applications we took in, how many permits we issued, how, how many phone calls we had, what types of inquiries we've had. More on a numbered basis. I was thinking quarterly. I wanted to get your thoughts on that. What you thought.
That seems reasonable. Quarterly.
I think you can always start with quarterly and then decide if that's the right frequency.
Yeah. And then it would be like, I'm thinking like starting July 1 because it's a fiscal year. I'm
Yeah.
not clear, Chelsea, maybe you know the answer to this. So on our annual report, the annual report that every department does, is that based on fiscal year or calendar year? I think that's always been confusing for me.
My guess is that it's fiscal year.
Okay.
But they
But
want
don't
all
quote
the
me.
numbers,
No.
they want all the numbers
It's
for
not-
the
Maybe
warrant
Paul's saying something.
by December.
Oh, it is? Okay.
That's when I
We-
usually get the email from Lori that, oh, we gotta have all this stuff. I don't know, I mean,
Paul, go ahead.
We've always been told it's a calendar year. You report,
Okay.
you
Okay.
report from December 1st to January 1st to December 30th. That was the way it always was. Now,
Okay.
whether that changed or morphed or some other department, that was what we were always told. To calculate, do all our calculations, all our tabular data entry for the annual report, and then all the narrative based on what happened the past calendar year. Now, like I say, it could have morphed into other departments maybe doing fiscal, but that was what we were always told. That was still
Yeah.
way back. Maureen was the secretary to the Board of Selectmen, and Janice Conlon was the administrator, and then Jean Kitchen after that. So that's always been the way it's been.
And I can
But it
follow up on
could
that.
Yep.
Yeah, I think that would be helpful, Chelsea, because like,
Yeah.
say, if it is a calendar year, we're going to report, I'd like to kind of figure out how to get this, whatever format we figure out.
Yeah.
Let's fill in the numbers for January 1, so we have a full year of whatever that time frame is, but it would be great to have the time frame. And at
Yeah.
least, we could start working on that. So maybe Heather, once you look at it, if you have any additions, you can send it out to everybody, and then we can review that at the next meeting too. to make
So
sure
should we
have the right-
try to capture January to June in the July meeting? Or just the quarter, just March to June?
I think just let's just come up with the format right now and then.
Ah,
and
okay, got
then
it. And
Chelsea
start
can get back
capturing in
to us.
July.
Yeah, and Chelsea can get back to us. If the reporting, if we're supposed to report on the calendar year, then we can decide whether we can go back and backfill those columns. But I don't think we need to do that right now. I think we just need to figure
Got
out the
it.
format of what's
I
going to
see.
make the most sense. Does that make sense?
Yep.
Okay. I think that would be really helpful for people to know and better understand. And I think Chelsea, you'll be a great objective view of it too, because we live it. And sometimes you forget things like, oh, well, the public would be really helpful to know this or know that. And, we could add that on. So
Yeah.
thinking about what we think residents should know about the health department, I think would be really helpful.
I think that's great.
Okay. Does anyone have anything else? Because we've got through our agenda.
Do we want to schedule our next meeting?
Yeah, we definitely need to do that because we need to get that on the book. We need to get a meeting before the end of June.
Okay.
If you want to pick one, or do you want to have Barbara just send a doodle out? I mean, that seemed to work okay for everybody, I think, right? The doodle.
Mm-hmm.
Okay, so why don't we just, if we look at
You
So-
think in the last week?
the very last week,
No,
what?
I
You'd
mean,
rather
I
the
think,
previous week?
yeah, I don't think we want to wait till that very last week.
Okay, so the week of the 21st, we want to try to find.
Yeah, yeah, and Barbara was gonna try to propose the Tuesday again.
Okay,
That's fine. I can do, I'm looking at my calendar. I can do that. Tuesday.
Tuesday, the 22nd.
I can, yep. Would that
I-
be Zoom still, everybody? Or it doesn't matter to me? I'm
Uh,
off that day.
So it depends,
The 15th.
it depends on what happens with the governor's order.
Okay. I thought it was after the 15th, but okay.
Yeah, right. So we may need to be in person.
Okay.
Is that
Uh,
too soon to meet on the 15th? Next Tuesday might be too soon.
Yeah, I
I,
think the 22nd is good.
So I may be out of town that week, but I can see if I can delay leaving. Is there any chance you could do the 21st in the morning, or does Tuesday work better?
I'm
No,
working
Tuesday
12
was for
hours.
you.
Oh,
Oh,
it's for me.
Nancy's working.
Well, my schedule changes after next week, but,
Oh, right, right.
I can't do that Monday.
okay.
And
All right,
I'm
so let me see if I
working all
can-
day. Yeah.
Let me see if I can rework my
Okay.
schedule for the 22nd.
Well, Chelsea, what about the end of the week before? I mean, are you available the end?
I am.
I could do the 18th,
I'm out of
17th or 18th I could do.
I'm out of town from the 16th to the 21st.
Oh, okay.
Okay, so let's do the 22nd and I'll try to figure something out.
Okay.
Or can we do hybrid and you zoom in?
I probably could do the remote participation
Yeah.
form if I
If
had
we
to.
have to meet in person, right, you could do that. Yeah.
Yeah.
Okay.
Okay.
Are we thinking the same time?
Tuesday morning.
9?
Sure.
That's good.
Okay.
I don't think it'll be too long. You will get, before then, a draft of Heather's contract, a draft
Okay.
of Taylor's, of Dennis's and Paul's for
Okay.
review prior to that. So watch for that. And then what was the other thing? Oh, the communication. So you'll get that.
And the shared services will vote,
Right. Well, Chelsea will have that.
yeah.
So we can vote on that as well. So I don't think it'll be too long of a meeting.
Okay.
I think those are the primary things. And then if we can figure out the formatting thing for what types of reports, that would be helpful at that meeting too.
Okay.
Okay. So I can make a motion to adjourn.
I second the motion.
Chelsea,
Aye.
Nancy,
Aye. Aye.
Mary Lou, aye. Meeting is adjourned.
Thank you.
Stay
Thank
cool.
Yeah. Another hot one today. All
It is.
right. Bye-bye.
Bye-bye.
I'm gonna stop by the office. I have a few things. I have those tablecloths and anyway, I'll swing by the office and drop that off. Taylor, you were there all day?
I'm here all day.
Okay, great. Thanks. Bye-bye.
All right. Bye-bye. Thank you.
Okay. And